Okay, we have Dr. Allie Chisholm. Did I say it right? Chisholm?
Yeah, Chisholm.
Yeah,
Yep.
Chisholm
Yep.
on the podcast today. She is a pediatric physical therapist. And I want you, Allie, first of all, just to say thank you. I'm so grateful for you to take the time between your patients and as a working mom to do this and to share your knowledge and wisdom with the listeners. So thank you for being here.
Yeah, of course. I'm happy to be here.
And just so the listeners get a sense of who you are, I'd love for you to just briefly describe your background and what brought you to the work that you do today.
I am a pediatric PT by trade. I went to school in Boston and got my doctorate in physical therapy. Basically, ever since I've been working in pediatrics, I had a very short stint in working at a skilled nursing facility slash nursing home and realized that that wasn't for me and wanted to go back to seeing kiddos. I've had a lot of different experiences in different settings, like home health, post NICU and home, as well as outpatient and school settings, research, like so many different things. So I have a wide variety of experience. But after I kind of left my nursing home job, I really honed in on like the infant population, especially like that zero to two age, just because that's such a vulnerable place for babies as well as for parents and moms. So I really started to hone in on that in the in-home care that I used to do and with like more post NICU medical complex cases. And then when I had my own babies, I had my first about 3.5 years ago, and my second I had 19 months ago. And with them, they had their own different like feeding struggles. And I found that the transition into motherhood was so much harder than I expected it to be. I expected it to be a little bit easier just because I am a pediatric PT and I do work with infants. So I was like, oh, like this, I feel like I have a leg up here. And in actuality, I feel like, in some ways I like almost knew too much, but it also just like was such a huge lesson for me. And ever since I transitioned into motherhood and realized like, breastfeeding is not as natural as it's like made off to be. Your birth might not go the way you want it to. Postpartum is like something that like I should have prepared for, but I didn't and didn't realize it had been helpful to do that. So there's just been so many lessons that I've learned from being an infant physical therapist, but then becoming a mom myself that have made me into the PT that I am today, where I can really incorporate care of mom and baby at the same time. The whole family is feeling supported versus me kind of just like talking at the parent and having the parent be a bystander in that situation.
Oh my gosh, yes. I remember myself pre-kids telling a new
Mm-hmm.
mom what I think she should do with no
Mm-hmm.
idea what it actually is like on the
Yeah,
day to day. And like you think, oh, like I have all this knowledge, I've read the research, I have the certification, I have the skills, but motherhood will humble you
it really
just
does.
right where you
Mm-hmm.
need to be humbled. So
Yep.
I love that you have this kind of new framework, this new lens that you're seeing your own services through. I see that you don't just treat the infant, you treat the mother as well, like almost as a unit. And so tell us
Mm-hmm.
a little bit about how you're able to support mom and baby through that vulnerable period of postpartum.
Yeah. So in terms of treating both, I'm not necessarily treating the mother physically. I am more so making sure that I'm really paying attention to what mom's goals are, what her concerns are, really holding space for her. Because what I found as a mom was that when my kiddos were struggling, the providers that I saw were basically like just shunned what I had to say. They basically didn't like take into account any of my own experience as an infant PT, but also like as a mom and the expert of my own baby and like what I was noticing since I was with them 24/7. And I found that really, really hard and disheartening. So with my model of care, what I do is I am obviously treating the baby with whatever they're struggling with, whether it is milestone delay or head flatness or head preference or lip or tongue tie. Of course like focusing on them and what I can do to help them, but I'm also really incorporating and collaborating that care with the mother or the other caregiver, whoever wants to be involved in the care, and really making sure I'm holding space for them, asking how like things are working for them, coaching them through certain vulnerable topics of being a mom and like if there are any struggles or anxiety around their baby having struggled with certain things, I have a lot of knowledge and a lot of experience in like holding that space for mom and helping them navigate through that in a way that feels empowering to them versus putting them on the back burner and not having them be part of the care for their own child.
Absolutely. Because it's so anxiety provoking to have an infant. First of all, just being, a new mom and in the
Mm-hmm.
postpartum period can evoke a lot of anxiety. And then
Totally.
having an infant that might be struggling with some kind of developmental milestone or feeding or whatever it might be. And so to have a
Mm-hmm.
practitioner like you to just see that and honor it and hold space and kind of coach new moms and parents through that, it's so amazing. I'd love to see your take on how you've seen different birth experiences correlate to certain things that you might see in the early postpartum period or throughout those first 1 to 2 years postpartum.
What I have found is that depending on how babies are born, it can affect how they present after, like when they're, earthside. So, as an example, my two babies, my first kind of got stuck on my pelvis. So, she had some like head shaping issues. It actually resolved pretty quickly, but I did notice she had some tightness on one side of her body that I was kind of like helping her take care of because she was stuck on my pelvis for a while during the birth process. With my second was born super fast. I just like shoved her out. Like she was in and out. And because she didn't really have time to like fully stretch out in that birth canal, she was very like tense and tight. And I think that really contributed a lot to her feeding issues. So what I found was that when I really was able to work on addressing those restrictions that I found that she had because of the fact that maybe she didn't get fully stretched out and squished out during that birth process, is that we are able to resolve that tension by kind of like working together on like stretching out our body and working on like therapeutic movement after birth, which really, really helped. But yes, I did see, especially with babies, for example, if they have a baby that is born via C-section versus a vaginal birth, because baby hasn't had really that opportunity to kind of be squished through that birth canal, sometimes they may end up with extra fluid in their lungs and need some help like releasing that fluid after birth, or they might have some extra restriction or tightness in their body because they didn't have that experience of being fully elongated in the birth canal. So those are the biggest ones I would say that I notice, as well as like the head getting stuck on the pelvis, and that can kind of contribute to some neck tightness or body tightness as well. But yeah, that's something that I always like to say that's not your fault at all as a parent. You controlling birth is like sometimes you just got to like let it go and like let that process happen, but that has nothing to do with anything you did wrong or anything like that. But those things are something that I do notice with the births that might end up that way.
Interesting that, I mean, what I know from studying physiologic birth is like
Mm-hmm.
every aspect is important and crucial to what
Mm-hmm.
unfolds afterwards. From a
Mm-hmm.
physical therapist perspective, it's, that compression, the elongation through the birth canal can really
Mm-hmm.
affect how baby develops in the early postpartum period.
Yeah, 100%. And most of the time, they're typically pretty easy things to address, but it's also something that like sometimes parents might notice it and not really know what to do or think that they can do anything. So I always like to say these things happen, they're not abnormal, and there's something that we can do about it so that it doesn't affect the baby in the future.
That's always
Yeah.
so helpful for parents to hear. Like, we can't control what happens,
Hmm.
and we can, do certain things to repair if something might go, in a direction that was unexpected.
Totally.
So, Allie, I like to talk about the early postpartum period because I just think like the golden hour, or as Barbara Harper was telling me the other day,
Hmm.
the golden 6 hours is so important. And we talk about reflexes in the developmental stages, but we don't often talk about the reflexes have you heard of the breast crawl?
Yes.
And then that leads to the first latch. I'd love to hear what your thoughts are on that, and how reflexes start like in the birth canal essentially for the baby.
Yeah. So primitive reflexes actually start in the womb. They actually
Mhm.
start being formed in the womb. So a lot of times, like when babies are forming those different reflexes, is that there's certain points in their gestational age that they're forming different reflexes, whether that is like sucking, like being able to cup the tongue and suck, being able to like swallow the amniotic fluid, like all those different things, like are part of those primitive reflexes that are what's the word I'm looking for, that come about when they are in mama's belly. So sometimes with babies is that if they're born a little bit early, they might not have the ability to, do the suck the pattern of like the suck, swallow, breathe, and all of those things. So that's something that I always like to mention to parents, is that all of those reflexes happen within the womb, and then they come out, and then they're able to do those different things like breast crawl and latch onto the breast, because it's like that's something that they've been practicing in the womb, and then they're able to practice that outside of the womb when they have that ability to do so, and they're given that opportunity. That's something that I incorporate in my care a lot, because reflexes are such a huge piece of like baby's initial movements. Those inhibitive reflexes are involuntary. So that a lot of times with that breast crawl is that's like an involuntary movement that they do automatically, where they're like searching for the breast in that way, which is really fun to see, like all of those things coming together to do something like a functional activity once they're outside of the womb.
Yeah, it's so wild to me that that's involuntary and so primitive, right?
It's like natural
Um,
to want to like be on your mom, biological, natural to be on your mom and be able to get up to the breast and try to start latching and sucking. So yeah, that's all part of like that primitive involuntary reflexes that babies start to have when they're in the womb and then when they're born.
Yeah, absolutely. And of course things don't always go as expected. And as you mentioned,
Mm-hmm.
breastfeeding sometimes isn't as natural. It doesn't come as natural as we think it will.
Right.
So how can like I know that there's controversy around like tongue tie and lip tie and all these things. So I'd
Mm-hmm.
like to get your take on how you support mom and baby or the families that you work with through those things, through the movements of baby and how they can support baby's reflexes and movements.
Yeah, so I got into the world of lip and tongue tie when my first was born. I didn't know a lot about it when she was born, and she had some issues with feeding and restriction that I was not aware of. I actually had to stop breastfeeding her at 3 weeks old because it was so painful, and she had such a hard time latching. She was dealing with reflux, gas, all of those things. And then I was able to relatch her and have her resume breastfeeding when she was about 3 months old, once she had some better head control and better control of her trunk and her positioning. And what I realized is that she definitely had some oral restrictions that I wanted to learn about. I didn't know a lot about it yet. So that's what I dived into it. Then when I took a bunch of training on it, like saw patients with on it and all of the things, and then I had my second about 19 months ago, and she had some restrictions orally, but her experience is a little bit different. I knew that she had some tension. I knew that she had some issues with restriction, but she also had a mild form of laryngomalacia, meaning that her larynx, she wasn't breathing, like she was breathing very fast. She wasn't breathing very efficiently when she was born. So I put two and two together and realized, okay, this is affecting feeding. Like she is having a hard time breathing when she's trying to feed. She can't maintain this latch. So I worked with her, like I brought her to different providers. I worked with her myself. I was told by my pediatrician, there's no way she has any oral restrictions and that it would be stupid to get a tongue tie release. With the other providers that I saw, they said that she had like a lip tie, cheek ties, and tongue tie that should all get released. And me being a mom, but also a provider, I wanted to find some middle ground because I intuitively knew as a mom, and like intuition is such a strong thing, that I didn't think that she would need the releases. And I personally wasn't comfortable with her having the releases. So after working with her, I decided to forego the releases, and she's now thriving and she's doing great. And we didn't get their tongue tie releases done. So kind of like wrapping that all up and taking that into how I treat kiddos now and help parents with that, is that I realize that tongue ties are 100% a thing, in the sense that sometimes they do need to be released, but I do think that some providers tend to be a little bit more release happy, in the sense that they might do recommend a release even when it's not needed. And so what I help parents with is that I help them recognize that a lot of the research shows that you can actually do conservative treatment first, and ethically it's the best route to go first before even recommending a tongue tie release. It might be the avenue you end up having to go down to help with any like functional impairments like feeding, like reflux, like gas, like tension, those sorts of things. But it's certainly not the first line of defense, if that makes sense. I really like help parents recognize that and realize, like, you know, even though it's a minor surgery, it's still a surgery. If your desire is to prevent the surgery from happening, then that's what I'm here and that's what I specialize in, is helping to prevent that, but also preparing parents for releases in like the best functional way possible. Since if babies don't have the range of motion that they need in their neck and in their tongue and in their mouths, then they're not going to have the best results from that release happening. They're kind of going to end up right back where they were, or they might, baby would end up kind of having even worse symptoms than they had before. My goal is to really educate parents on like what their options are. And that way they can come to like an empowered decision, again, coming from that collaborative approach versus like being like, I'm going to tell you what your baby needs and you have to do it, or like some things are going to go terribly wrong in their future. I just think that's such a disempowering way and to, deal with issues with babies and like considering their parents and what their desires and wishes are too. So yeah, so I work a lot with that with parents virtually as well as in person too.
I love that so much. Just taking the route of, okay, this could be something functional that we can work on before moving on to this minor surgery that may or may not even have the results that you're desiring.
Yeah.
Yeah, I love that approach so much. Speaking of that, I want to move on to tummy time because we're told, from day one, we got to have them on their bellies. And I think this is coming from the pendulum swing from kids, right? Sudden infant death syndrome, which causes so much anxiety for parents with newborns. So talk to us a little bit about that and how it can actually impact feeding and positioning of the tongue and latch and all of that stuff.
Yeah. So with the tummy time, what I always like to tell parents is that tummy time is something that it is definitely important to work on, especially like you can work on it from day one. And it's not like a plausible thing to expect a baby to be able to fully tolerate being on their bellies, head lifted up, like fully being able to function in that position right from the get go. So I always say with the tummy time, positioning wise, is when you practice it, feel free to do it like on you, especially in those first 3 months, depending on how birth went for mom. Like maybe she can't get on the floor. I say, like, you can do it on your chest. You can elevate your baby by putting them on the ball or on like a yoga ball or something and having them be elevated. So that way that it's easier for them, it's easier for you, and it's more of an interactive experience and less stressful experience for both mom and baby, especially if baby doesn't like it. If they do have gas or if they do have reflux, a lot of times they don't like significant pressure on their bellies. So that's just like an aside of like, there are multiple ways you can do it and it all counts. In terms of belly time and how it affects like the tongue, so the force of gravity is something that I really like to talk about a lot when babies are doing different positions as well as on their belly. So when they're on their belly completely flat on the floor, that's when the force of gravity is at its highest. So that is affecting how they're able to pick up their head, their tongue moving upwards in their mouth and moving side to side in their mouth. That's of course strengthening their tongue and their oral motor skills when they are able to practice like moving their tongue around in that position, as well as like the suction when babies have to learning how to breastfeed or bottle feed. It's helping them with the ability to cup their tongue and like really get that breast or that bottle in their mouth and suction it and latch onto it for longer periods of time. So it builds up that endurance as well as with being on babies' bellies. They are born being very tucked up in this like what's called physiological flexion. So this like tucked up position because that's how they are in the womb. So what belly time helps with is really elongating their body and getting them comfortable not being up in that tucked up position. Not to say that that position is bad. I actually use that as a soothing technique, is if I'm like really, if baby is fussy or upset, I'll help parents like direct them on how to do different positions to help soothe them. And that's one of them, is kind of getting them nice and close to you, getting them a little bit more tucked, because that will remind them of how they are positioned in the womb, as well as that flexion is calming. So whenever baby's fussy, like I'll say to parents, like even put your finger in their palm and they'll close their hand around your finger. That's a calming thing for babies, anything that were like flexed up at all. But that's what tummy time helps with, is helping them be able to elongate their bodies, improve their range of motion, help with like the movement of their tongue against gravity, all of those different things, as well as belly time also helps to optimize breathing. So I also like to say this in terms of sleep as well. when babies are having trouble breathing through their nose, I actually say to parents, like, if you can do a supervised, obviously, like within reason, as a disclaimer, like I can't say exactly what, like for your specific baby to do this, but I will say this with to parents a lot is if you can supervise your baby taking a nap on their belly, they'll most likely close their mouth or breathe. They're more so likely to breathe through their nose because it's just optimizing the breathing and really equalizing the pressures in their abdomen, in their chest, in their oral cavity in order to breathe through their nose. So even if you're an adult, breathing on your belly is really, really great for your spine as well as for breathing and to optimize that too. So I like to mention that there are so many benefits of tummy time, and if you're not able to get on the floor, it still counts if you're able to like do it on your chest or on your lap and elevate them. So yeah, does that answer all your questions?
Yeah, absolutely. And you went like above and beyond so much, so many nuggets of wisdom there that I hope
Yeah.
moms who are pregnant right now can really take in, and moms
Mhm.
who have little ones at home. And have you seen shifts in feeding with some of the recommendations that you're describing?
100%. I do work a lot on whether baby is like post tongue tie release or trying to avoid a tongue tie release, and the parents are noticing some struggles with feeding or reflux or gas. I notice if we use like these holistic approaches of working on positioning, working on tummy time, working on elongating the neck and the body and really taking away that tension, it has such a significant impact on feeding that a lot of times those functional issues that parents have noticed tend to be resolved. So incorporating these different things can be so, so helpful.
I'm just thinking of the parents who are like traumatized because their baby is considered like quote unquote colicky, and how some of these, you never know exactly what the cause is for every single
Totally.
baby, but how some of
Hmm.
these simple approaches can, save them so much grief and so much sleep and
Yeah,
all of that stuff. So,
100%.
yeah, so it's so amazing when you really
Hmm.
work with the body as it's developing versus just assuming something.
Totally.
I did want to touch briefly upon plagiocephaly,
Hmm.
because I know that that's something that you work with. Because from my knowledge and from what I've seen, the helmet is the answer, and that's not your answer. That's not your approach.
No.
I'd love for
Yeah.
you to give us your approach, your take on that.
Yeah, with the helmet, it's one of those things, again, it's not bad. If that ends up being the route that a parent takes, then that's okay. It's not a bad thing, but I am personally a provider that always likes to take the least invasive approach first before going into a more invasive approach, like a helmet, for example. So with that being said, there are different parameters like that kind of have to be met in an assessment in order to like for me to like for example say okay yeah I think a helmet would be recommended in this case. So for instance, if a baby has like mild, what's considered mild or moderate head flatness when they're between like 0 and 4 months old, typically I'll say you really most likely will not need a helmet, and this can be solved and treated with conservative care, i.e. physical therapy or occupational therapy or anyone trained in helping babies that have plagiocephaly or head flatness. Once babies get from like 4 to 6 months, 4 to 7 months, if there's like a mild form of plagiocephaly, I'm like, okay, we can still treat this conservatively. Their head might not be perfectly round, but we can definitely still make a difference here. Once babies get to like above 7 or 8 months old, that's when the sutures in the brain have hardened more so, and it's harder to make those changes conservatively, and that's when a helmet tends to be recommended, just because baby is so active and on the move that it's hard to do any sort of positional changes to help with the shaping of the head. With that being said, if a baby has like super severe head flatness like right from the get-go or at that 4 to 5 month mark, then that's when I might say okay, it would be really helpful to go see an orthotist to get assessed and get fitted for a helmet. But I probably in my career have only had like, a handful of patients that I've been like recommending to go get a helmet, especially if they're on the older side. But I always say, the mama intuition, the mama gut sort of situation is if you're noticing some head flattening or a head preference earlier on, the earlier that you get it treated, the more likely that you'll be able to one, avoid a helmet, and two, the shorter amount of therapy that you might need, and three, the more likely that it's not going to cause like long-term issues in the future. So it just kind of improves those success levels if you're able to get it treated conservatively, which I know is not the typical thing that you might hear from a pediatrician who loves the wait and see approach. I always like to mention that too. It's something you notice, like you can always just ask, you can get an assessment done. If we don't need to do some subsequent, therapy or visits, that's perfect too. But at least now you can kind of be empowered in that and knowing that you like were able to advocate for your baby and get some answers.
Yeah, that is such an empowered approach, just to have that information and know what your options are. And for anyone listening to know that on the other end, if you do have to go the route of the helmet, your child may become a bit attached to the helmet. It becomes like
Mm-hmm.
an extra appendage, right?
Mm-hmm.
So it's hard to
Yeah.
kind of get that helmet off afterwards.
Yeah, and also with the helmet is that a lot of babies, it takes a lot of getting used to too, because they're expected to sleep in it, they're expected to wear it all day. So it can just be something that the baby finds really bothersome too. And it can kind of hinder their development in a way because of the fact that it's something on their head and it's going to be harder for them to lift their head and move their head around with that on too. So it can just limit their movement in more ways. So I always say, like, again, helmets are not bad. If that's like the route that you go, it works and we can talk about it. I always encourage parents, make sure you're also seeing a PT to address any sort of like restrictions that your baby might have. So like that head flatness doesn't persist. But yeah, I think that like whatever route you go is, perfect for you and your family. And there are other options. Again, like there's other options that you can do instead of just waiting and seeing if that's not what you want to do.
Yeah, the wait and see or like the monitor approach is
Mm-hmm.
it's an approach, and like
Yeah.
while you're waiting and seeing, you can do all of these other things.
Exactly, exactly. And most of the time when you're doing these other things, like from like a therapeutic conservative approach, you can avoid those more invasive forms of care for the most part.
Absolutely. Allie, I want to switch gears a little bit. I know that you recently you've had quite the 2024 year.
Yeah.
And and I did read one of your blog posts, and it brought me almost to tears. And so many women, just, even in my circle of friends, the patients that I treat experience loss and don't really have
Mhm,
a space to express that. And, as a mom of two, you had two little ones
mhm,
as you were going through this. So I'd love to hear, because you were an active mother during this phase, I'd love to
mhm.
hear what route you took just to kind of get through it, and permissions
Yeah,
that you gave yourself and how you sought out support and all of that. I think it'd be really helpful for listeners.
of course. And it's one of those things that I found it very isolating because it's something that can be really taboo to talk about. You don't know who has been through it. You don't know like who to turn to. And when you're struggling so much, it's one of those things that like you still have those expectations on yourself to be a good mom, to be a good wife, to be a good friend, caregiver, whatever. I found myself going through this internal battle of like I still want to be there for my clients and I still want to be there for my daughters. I still want to be there for my husband and still be a good friend. And I kind of had to like pull back on a lot of that and just say like I am surviving right now and my family is getting the best of me right now, and even if I can't be fully present, like I'm still there, I'm still taking care of them. And that really helped me to just like take the pressure off myself a little bit, as well as I will say, like opening up to people and being willing to open up to people. I like voiced a lot of this on social media too, like in a professional sense and like a sense that of like, okay, like if you're also going through this, you're not alone, sort of thing. And I found that so many people like reached out to me and like told me their stories and told me like, I went through several miscarriages and I still had a baby, or listening to different podcasts. There's a couple podcasts that I can like give resources to as well that I really found helpful. I found a therapist that I even just to like vent and just get your thoughts and what's going on in your head off your chest. I found that really, really helpful as well. And just like being able to open up to people that you trust. I think I am someone that is very like, go, go, go. And I'm just going to ignore these emotions and keep moving forward. So for me, my first two losses, they were earlier miscarriages at 4 and 6 weeks. So I was like, all right, I just gotta like, this is what I have to take the lesson from this. This is what this means. And then like, I would make the changes, I would do the things, and then I would keep moving forward. But then I put off those emotions. And I think that's what was really hard for me, because when I had my last loss, my third loss at 15 weeks in October of 2024, everything hit me so hard. Like the feelings I had about my previous miscarriages, the one that I had, the feelings I had about this miscarriage. We were also in a hard time because my husband had just started the fire academy. So I was being like the primary caregiver in that moment for my daughters at the same time. So, like, for me, I noticed like I held a lot of those emotions in. And by actually releasing them and letting them go and feeling them, that helped me significantly. In the moment, it was super, super hard. And afterwards, I feel like I was able to move through it a lot, so much more gracefully and with so much more hope because of the fact that I was able to feel those emotions, open up to my husband about how I was truly feeling and what kind of like asking for support, like asking family members for support and just being like, can you, help me with the girls for this day so that I can get some stuff done around in the house so that I could keep my environment, if the environment's cluttered for me, then I get really like anxious and stressed out. So anything that I could do to like get support, talk to people that I trusted, as well as like having a therapist, but also like being able to feel those emotions and let those move through me, not getting stuck in them necessarily, but like telling myself it was okay to feel those and it was okay to not be okay. It was okay to not have a lesson come out of these hard experiences. Then that is what really helped shift me from so much despair and so much pain to more hope and more like gumption, I guess, that I can really be an advocate in the space and be someone that can be an example of how you can move through these things, still feel everything, know it's such a painful thing to experience, and also see the light at the end of the tunnel with it. Because yeah, I think it's one of those things too that I never want a mom to feel like this is something that they are so alone in, because it's such an isolating experience because it's something that can be so taboo to talk about.
Thank you so much for sharing that. And when
Mm-hmm.
you said that I don't need to get a lesson out of this right
Mm-hmm.
now, because when you're a practitioner, when you have kind of this like growth mindset, you're always like, okay, like what can I learn from this? How can I move forward? What are the underlying
Mm-hmm.
lessons? And sometimes it's really just about letting yourself be
Yeah.
and feel your feelings, which sounds so simple, but I would say like
Mm-hmm.
80% of us don't allow ourselves and give ourselves permission to even go there.
Yeah,
It's hard when you have little ones, right? Because
it
they
really
need
is.
you, and just feeling safe enough to ask for support so that you can get the things done that you need to get done, but also get the
Mm-hmm.
support that you need.
And just like speaking on like the just being piece, these losses that I went through, it really like reshaped my relationship with my kids too, because I think that I'm someone that's always like very go go go, like very like I have to be productive, I can't relax, and it really forced me to like sit back and be like and just allow me to sit with my kids and just be with my kids. Not that I can do that for long periods of time because my brain is all over the place all the time, but it's like still like one of those things that like it really just forces you to be in the moment. And I think I fought that for a while, especially when I was going through those initial losses. So when I was really able to like sit down and feel my emotions, be with my kids, be with my family, I just felt so much weight lifted off my shoulders instead of putting so much pressure on myself to keep moving forward, if that makes sense.
Yeah, absolutely. And that's one of those silver linings that we receive from those tragedies is just appreciating being present with the people that we love.
Mm-hmm.
So beautiful. So Allie, before we wrap up, I did, because again, this is a birth podcast. So I did want to ask you for your own birth experiences, if there was something that you
Yeah.
wanted to share with the listeners, no matter how they unfolded and what you learned from them and what that experience was like for you.
My experiences are a little unique in the sense that for my first one, I went to a teaching hospital up in Maine. So that was my first birth that I had. And that birth, I kind of went into not really knowing a lot. Like I kind of was just like, oh, like I want to have like an unmedicated birth if I can, but if it doesn't work out, that's okay too. But I think I went into it very blind, and I found the experience to be really tough. Found it to be really painful. I had a lot of trouble like with coping and breathing through everything. That birth was about 25 and a half hours long. So it was a really long birth too. And I loved the doctors. I thought they were great. But like there was some experiences of the nurses, I guess, were like kind of rude to my sister who was there. And like my daughter, she was like kind of like trembly when she was born because I am on anti-anxiety medication. So that's something that they noticed. And I kind of like felt like it felt like I was being judged a little bit because of that. There were like pieces of that birth and pieces of that labor that I wish I could go back and change. But at the same time, I'm like, okay, like this experience helped me with my next experience, with my next birth and how I wanted that to go. So with my next birth and my next daughter, I actually got a doula. I found a different hospital that was more like a community hospital versus a teaching hospital. With my first one, I also had like 10 people in the room. So there was a lot of people there. I like didn't really feel like I was really advocating for myself a lot in that moment because there's just so much going on. So with my second, I got a doula. I was in more of a community setting. I was seeing midwives instead. And I just felt so much more taken care of in that birth, even though it was very fast. That one was 5.5 hours. And I remember being at home and like because I wanted to be at home for as long as possible before going to the hospital. Like I had started throwing up and going through labor and stuff, and I was like, it just didn't feel like I was as far along as I was because I was comparing it to my first birth. So but when I got to the hospital, she was born within like 45 minutes, so I was like, okay, that went a lot faster than I thought. So just to like say that I feel like every birth is so different, every experience is so different, even amongst your own kids. So that's something I figured out with both of my babies. And the last thing I wanted to say is that I've always had a dream about having a home birth. With my losses, with my second loss that I had last year, I had actually hired a home birth midwife. And then with my third loss, I had hired another home birth midwife. Not that the other one, I didn't like her. It was just more so I connected more with this other one that I found for my third that ended up being a loss. So for me, when I have another baby, I'm deciding to get more support via going to an infertility center and getting more support during the first trimester and going back to a hospital setting. Most likely, if I end up deciding to go back into the home birth route, I will. But just like from an aside of like, I love that holistic midwife sort of approach. And like with the experiences that I've had, I'm like allowing myself to get the support that I need and really advocate for myself in those ways and recognize what didn't feel good when I had those losses too. So I wanted to share all that. Are there any other questions related to the birth stuff? I know I kind of went through them quickly.
That's beautiful how you kind of took your experience from the first one and you were like, oh, I didn't really like that. I want things to be a little bit different. And I've said this on the podcast before, but research shows that just having a doula present in the
Yeah.
room shifts things dramatically for the person who is in labor and giving birth. It's amazing that you made those shifts for yourself and that you're able to advocate for yourself. And it sounds like you've had several experiences in many different circumstances in the birth world, in the labor and delivery kind of unit and that kind of stuff. It sounds like overall you're just kind of you're honoring where you are and
Yeah.
you're reaching out to the practitioners and providers that you feel will support you where you are. And I think
Yeah.
that's the empowered approach that we want for all mothers on their journey.
Yeah. I know. It's one of those things that I have found that you have to be like an active participant in like your birth and the location and your pregnancy. And a lot of the times it's like kind of it's this catch 22 of like it stinks that you have to like ask for all of these things. Sometimes it's like, can you like treat me like you give me the support that I need without me having to ask you, or treat me like this kind way without me having to ask you. But at the same time, I've realized like the more I go through these different experiences, the more I'm able to advocate myself and the more I know. And like that just makes my births and my pregnancy experiences that much better because I'm coming at it from that more empowered advocacy approach versus kind of, being on the sidelines and just letting other providers dictate what I should be doing or whatever.
Yeah. And it goes back to what you spoke about earlier is that maternal intuition and you're letting that guide you and you're coming from that space and that
Totally.
always that you know I could say 100% of the time, I don't know, but 100 like 99.99% of the time women are more satisfied with the results when
Yeah.
they let their intuition guide the way instead of fear.
100%. Yeah, I 100% agree. And that's what my experiences have been, whether professionally or personally with my own births.
Yeah, absolutely. So, Allie, my last question that I ask all my guests is because speaking to women who have been birth workers or birth guardians for many, many years, and my own intuition, we see that there is this profound imprint that takes place when a new life is entering this reality. And that imprint can be love, safety, trust, and peace, depending on what's going on in that room, depending on how the mother feels, because mom and baby are so intricately connected. And the oxytocin and the dopamine and all of that imprints that into our cellular memory. And then this new life grows up and moves through the world from that place instead of being imprinted with fear and mistrust and survival mode, which is what happens when the mom might feel uncared for or might feel scared during the experience. And the other people in the room also feel that way. And it's not something that we can control, and it's not permanent. We can do things to repair the hormonal gaps that result from that often. But if we can prevent it, why not? Right. So if you would like to imprint something onto the ears of the listeners, it's a lot of mamas preparing for birth. It's a lot of new moms, new parents. What would you like to imprint onto the listeners?
I think with this one, I always like to say to moms that one, your body was made for this. It knows what it's doing, even when it is a hard or traumatic birth. It's so hard to go through those situations and have this mistrust in your body too, especially if it doesn't go a certain way. And with that being said, if it doesn't go a certain way and your baby does have any sort of tension or tightness or whatever, that isn't your fault, because I find that a lot of moms, especially, put a lot of blame on themselves when their babies struggle or when they struggle post birth, like regardless of how the birth goes or how that baby came into the world. And I just want to say that you had no control over this and this is not your fault. And yeah, there's help out there that can help support you in those moments.
Beautiful. Thank you so much, Allie, for taking the time to do this. When people see this on video, they're going to see that you're in your car between patients. So I really, really
Yeah,
appreciate you doing this.
of course.
And our discussion was so full of so much wisdom and knowledge. So I really, really appreciate your work and how you're serving new parents, how you're serving mom and baby. How can the listeners get in touch with you? How can they learn more about your services and what you do?
Yeah, so if they want to connect with me right on Instagram at the moving peanut, if they have any questions, feel free to send me a message there. I do free consult calls too. So if you wanted to schedule something, if you have concerns for your baby, feel free to reach out to me on Instagram. We can set something up. And or if you have any questions about what we talked about here, I'm happy to answer those on my Instagram page as well.
Awesome. I will put all of the links in the show notes for people so they can easily reach out to you. And also, I did want to ask what the names of those podcasts that really helped you were.
Yeah. So the biggest one that helped me the most was called The Worst Girl Gang Ever. That was the one that I found most helpful. And then the other one, so I kind of like would listen to a conglomerate of ones, but one that I have found helpful just to give me some hope is The Birth Hour. They have different ones that have stories of moms who have gone through loss and miscarriage and how they've dealt with that, or how they have like the babies or the experiences they had after those experiences. So I find that helpful too. But I would say the best one to go to is called The Worst Girl Gang Ever. They have a book as well that like was just so pivotal for me when I was going through like in the trenches of going through loss, that that I would go back to, because they have a section too on like pregnancy after loss as well. So I'm planning on revisiting that when we plan on having another baby. I would say that's the biggest one for sure.
Okay, awesome. The Worst Girl Gang Ever.
Yep.
Yeah. Okay. I'm going to put that in
Yep.
the show notes as well.
They
Okay,
have an
Allie.
Instagram as well too. So if people want to check out their Instagram, they have that too.
Okay, cool. I'll put that all in. I think that's going to
Yeah,
be really helpful for people. Thank
of
you again.
course.
Thank you so much. And we stayed
Yeah,
within your break between patients. Go and keep doing all the amazing things that you do for mom and baby and
of
the whole family.
course. Thank you so much. And thank you for having me. This was awesome.
Of course. Okay. Bye, Allie. Bye,
Bye.
everyone.
Thank you.